Hi, everyone. Good afternoon. I'm Dr. Omon Imohi. I'm a GP in Merseyside and the founder of Black Women in Health. I'm here to talk about improving diversity in healthcare. I'm not going to be talking about anything new that we've not heard before because I'm sure we've heard this talk so many times, and the speaker before me spoke about diversity as well. So I'm just going to talk about in this presentation, I want us to explore the importance of diversity in healthcare, the strategies to enhance diversity in healthcare. And I just want us to have it at the back of our mind whilst I'm talking that healthcare organizations that embrace diversity benefit from improved patient care, increased innovation, and a more inclusive work environment. So, what exactly is diversity in healthcare? It's really simple. Diversity in healthcare just refers to the representation of different racial, ethnic, gender, religious, socioeconomic, and cultural backgrounds among healthcare professionals. And it's crucial that we have diverse healthcare teams that reflect the diverse populations that we serve. As we know, the United Kingdom is a global village. We have someone from every corner of the world living in the UK at least. So I think it's very important that the healthcare teams actually reflect these diverse patient populations. Why is diversity in healthcare important? And I just want to touch on three main things that I think are really important when we think of diversity in healthcare. The first is that it improves patients' outcome. As healthcare professionals, as a GP, my main focus is being patient centered. I want my patient to have a good experience. I want my patient to have a good outcome. And I'm sure that's the same for most healthcare professionals. And studies have shown that diverse healthcare teams provide better patient care and better patient outcomes because they bring a unique perspective and diverse cultural insights. Another thing that diversity helps to address is healthcare disparities. As we know, there's healthcare inequalities, and diversity in healthcare can help to address these healthcare disparities and improve access to care for the underserved communities. And just taking into context, someone from a minority group understands the problem that the people in that community go through and understand the needs of the community. And it might be simple things like just providing an interpreter for a consultation, providing leaflets in languages that can be understood by the community. So little things like that can help to address health inequalities. And it also enhances innovation. Diverse teams foster innovation and creativity. When a team of diverse healthcare professionals are valued, respected, and appreciated, it helps them to be more creative, and it enables the development of new solutions and approaches to healthcare challenges. So, diversity, as we can see, is really important in healthcare. But as with everything, there's always challenges, and the challenges in achieving diversity in healthcare, um, despite being something that we talk about all the time, we talk about diversity, EDI, all the time. But despite recognizing this importance of diversity, equality, and inclusion, there's still several challenges. And one of the main challenges is underrepresentation. So there are certain, racial and ethnic groups or minority group or marginalized communities are underrepresented in healthcare professions, more so in leadership roles. And if we don't have enough of the voices that we need from the minority groups or from the specific ethnic groups, how do we understand the problems that the population is facing, and how do we solve this problem? So this is one of the problems we have, one of the challenges that I've seen in my career, in my experience, on the representation. Then we also have the bias and discrimination. It could be conscious or unconscious, implicit bias, but discrimination and bias can hinder recruitment. It can hinder retention and even advancement in career. So we've heard stories, we've seen situations where, just due to some special characteristics, you're not recruited or you're not retained, or you have difficulty advancing in the career. And these challenges, we need to address them. I think we need to move away from talking to action. And the last one is the lack of cultural competence. Limited cultural understanding and sensitivity can lead to disparities in patient care and eventually in the patient outcome. And I think simple things like understanding, why a patient is speaking a certain way, or their religious beliefs or their cultural beliefs, can really limit the kind of care we give to them. So, how do we improve diversity in healthcare? I'm just going to talk about a few strategies, and it's just really going back to what those challenges are, underrepresentation, bias and discrimination, lack of cultural competence. So, first and foremost, enhancing outreach and recruitment. So, why not collaborate with educational institutions, medical school, nursing school, other healthcare schools, community organizations? One thing I saw during the COVID pandemic was that, you know, stakeholders involving themselves and engaging with community leaders, even spiritual leaders, Christian, Muslim leaders, community leaders, it brought us all together, and we were able to go through that difficult time. And I think it's something that should be taken forward in every other aspect of medicine. Collaboration with community organization and community leaders makes a massive difference. Collaboration with professional associations to promote healthcare careers, like what we are doing here today, amongst underrepresented groups, can also improve retention, recruitment, and advancement in the career. Establishing mentorship groups and programs to support and guide aspiring medics or already, thriving healthcare professionals from diverse background. I think for me, I had very good mentors. Most of them were not BAME or black men doctors like me, but there was a time when I really needed someone from my background, and an international graduate, to understand the challenges I was facing, to understand the difficulties I was facing as a junior doctor. And I think that's where it comes into place, and it takes us back to the underrepresentation. If we are underrepresented in the leadership roles, then where do we get the mentors from? Where do we get the support from? Where do we get the sponsors from? So there needs to be an enhancement of collaboration with all these institutions. The next thing is addressing the bias and discrimination. I think it's very important that we are all challenging bias. We have to be challenging it. Don't be silent about it. Don't just be a bystander watching someone if it doesn't concern me. We all have to challenge the bias and discrimination, especially when it's very obvious. And things we can do organization wise is implementing diversity and inclusion training programs for healthcare professionals, for medical students, for anyone at all working in the healthcare industry, to increase awareness of what bias looks like, because sometimes it's not very obvious, and to foster a more inclusive work environment. Also, the NHS and leaders in healthcare can create policies, procedures that promote diversity and ensure equal opportunities for career advancement. Another thing that can be done is, providing policies and procedures where people that witness bias and discrimination can speak out and be safe and not be punished for speaking out. So I think all these things can help us address bias and discrimination. Another thing is cultivating cultural competence. I think it's integral that cultural competence training should be put into healthcare education programs to equip future professionals. If you look around you in the UK, it's very diverse. It is very diverse. But do all healthcare professionals understand how to help the diverse population? My answer is no. I've seen situations where patients didn't get the right outcome just because of lack of cultural understanding. So I think this cultural competence is something that should be integrated into education programs to equip the future professionals with skills that will provide cultural sensitive care. Also, to encourage ongoing professional development. We can never stop learning, and sometimes we need to unlearn some things. Some people have a mindset because this is what they've been told about a certain group or a certain ethnic group, a certain racial group, and they need to unlearn that and learn the right way. And so continuing education on cultural competence for healthcare professionals is very important. And finally, building supportive networks, building supportive work environments. I think fostering a culture of inclusive and respect within healthcare organization. We are all diverse. We all bring our uniqueness into it. So everyone should be valued, respected, and appreciated for what they bring into the profession, what they bring into the organizations where they work, and be celebrated as well. Everyone wants to feel celebrated and appreciated. So I think establishing employee resource groups and network groups, That was one of the reasons why I created Black Women in Health, because we just wanted somewhere where we could connect, understand each other's needs, engage with each other, empower each other, support each other. And I think groups like that, networking and connecting and creating mentorship opportunities for underrepresented healthcare professionals is very important. And I just want us to remember that, you know, improving diversity in healthcare is not only morally imperative, but it's also a strategic advantage for healthcare organizations. Most organizations that value, embrace, and celebrate diversity are forward thinking and they are very successful. So, by embracing diversity, healthcare can better address the needs of diverse patient population. Sometimes I think, okay, if you can't even embrace diversity in the workplace, then how do you treat the patient? How will you treat the population if you don't even understand? And that's why it's important, because it enhances patients' care, it enhances patients' experience, and it brings better outcomes. It drives innovation in the healthcare field. So I'll implore us that let's work together to create a more inclusive and a diverse healthcare system for the benefit of every single one of us, because we all have a role to play. It's not left to any group of people. I'm one of the co-leads of the EDI group in my faculty, but I always say, we all have a role to play. You don't have to be the leader. You can lead from anywhere. You can see something and speak up. You can see something happening that you don't like and make a difference. Suggest things at work. Can we have leaflets that that's easy to be read by people who don't understand English? Can we have interpreters ready for patients? Just simple things like that. And I just wanted to close by sharing this flyer I created with my colleague, Dr. Adeko, in 2020. We created this diversity in healthcare flyer. And we focused on three C's: clarity, change, and camaraderie. Clarity is just really important. We have to be clear about, be clear. Diversity is clear. It's always obvious. It's there to see. But we have to corroborate the fact on diversity in leadership. There has to be diversity in leadership for us to be able to serve the population that's diverse. And so, constituting and adapting equality and diversity policies and guidelines, and very importantly, communicating and sharing diversity information and opportunities, because sometimes people don't even know that some roles exist, or some bursaries are available, or there are some research grants available, because it doesn't flow in their circle. So it's very important that these opportunities, this information is out there for everyone. And I already talked about change. You have to be the change, challenge the mindset, challenge diverse bias and discrimination when you see it happening, change the mindset. And we need to all collaborate to effect change and continue to evolve. Growing, learning is a lifelong process. No one ever knows it all, and we will never stop learning. And camaraderie, I think this is also very powerful, see, because it's talking about building bridges, allyship. So even if you are not from a minority group, or from a gender-based group that's needing support, you can be an ally to that group. You can unlearn and learn. You can be conscious and active in encouraging other people to unleash their potential. And on this flyer, you can also see EAT. Everyone is unique. So we have to accept and embrace our differences, because together we can make our patient and colleagues' experience better. And finally, I want to implore us. In the last talk before mine, someone asked a question and made a statement about moving beyond the rhetorics and moving from talking into action. Yes, we really want to see action. So always remember diversity. D, difference is good. Inclusion is important. Value others. Equality really matters. Respect regardless. Silence is definitely not acceptable. And institutions and organizations should create zero tolerance environment. Training is vital, so we have to keep learning. And you can be the change. Be the change you want to see. Thank you. I don't know if anyone has any questions or comments. I'm happy to take any questions or comments. Thank you. Oh, I like this question. You can beat the chain. Will you encourage people to choose GP? Yes. Yes, yes, yes. I'll encourage you to choose GP. I'm very, very much 100% team GP. So when I first started, when I first left medical, after medical school and my foundation training, I was not sure about what I wanted to do. I liked medicine, I liked obstetrics and gynecology, and I had never really experienced GP. But when I couldn't get into obs and gynae, one of my mentors just said, well, have you thought about GP? Because if you're a GP, you will be seeing women, you'll be taking care of women, and you'll be doing a lot of like gynae clinic stuff, especially as at that time I didn't really like the surgical aspect, to be honest. So I was like, yeah, that's something. And again, you would do a lot of medicine in GP as well. So I decided to go for GP and I've never regretted it. I will not look back. GP is one of those professions where you take care of your patient from cradle to grave. And there are days when it sounds like it's like simple things that you see, but there are days when you actually see exotic medical conditions as well. There are days when you're just a shoulder to cry on for your patient. There are days when you're an advocate for your patient. You can make a difference in the lives of your patients, in their families, in the community. GP is one of those careers that's all round, it's holistic. You deal with your patients and you look at the socio-economic aspect, the mental aspect, the physical aspect, and you tie all this together and you actually do make a difference. So yes, I would say choose GP is the best. I'm a bit biased because I'm a GP, but yeah, it's the best. Thank you.
Fantastic. Thank you very much, Omon. It's really great to have your input there. As a paramedic, I can definitely vouch for GPs. We work with them a lot, and I think a lot of the workload that I undertake is primary care focused. Unlike what people tend to think, it's not all emergencies, and we do a lot of urgent care as well. And it's nice to have that generalist approach to things and that experience, and it really comes through in the way you talk. So thank you very much. It's great to have you on board.
Yeah.
Any more comments and questions, please do share them online and on social media at #HealthCareersLive. We're going to have a break now for dinner or lunch.
I can see one. Do you want me to answer this question? What can be done to bring the issue of EDI further to the fore? As far as you know, the government and its agencies feel they're doing enough by putting it out there. Professionals need to take issues of EDI to them. How can this be done? I think the first thing I'll tell everyone is be involved. If you want to see a change, be involved. A lot of times we see colleagues talking about EDI and they don't want to get involved. They don't want to be at the forefront. So you have to be a voice. You have to be at the forefront and you have to speak up. And you yourself can create policies and share it and suggestions. Okay, like the flyer I made, no one asked me to do it, but I just thought, well, it was the period after George Floyd incident, and there was a lot of talks about diversity, inclusion, and I've experienced racial bias. I've experienced discrimination, and I just thought I can do something about it. I may not be the prime minister, I might not be the Royal College chair or president, but I can do something. And I created the flyers and I shared it on social media. I shared it everywhere to anyone who was interested, and we got conversations going. And when I started the group Black Women in Health, one of the first conversations we had was dissecting diverse experiences in medicine. And we had like a listening event where we just talked about our different experiences. And I took that suggestion and we had something like that in my faculty where we had listening events. And we had, both the BAME colleagues and white colleagues and everyone else. And some people were shocked at stories when they were hearing experiences of colleagues, that have faced discrimination, and not only racial, gender, religious. So it was eye-opening for some people. So sometimes you have to take that step. And the good thing that came out from that was that we started having bystander training done in our faculty, and this rolled out to other faculties as well. So you can start the change. It might be a small ripple, but it might just be a small dot, but it can make a ripple in the ocean. So just start with what you know, raise your voice, use your voice as an advocate, and be at the forefront, speak out. Basically, that's what I'll say. Okay, I'll answer this last one. What should a doctor do if a patient shows ethnic discrimination with a doctor? The first thing I'll say is always be very professional. Two wrongs don't make a right. So be very professional. It can be very upsetting because I've experienced it myself. Be very professional. And if you're in the position where you can actually speak to the patient calmly, do it. If you feel that you will be very upset to speak to the patient, then you might need to escalate it to your manager or a colleague or anyone else who might be able to then tell the patient that what they've done was unacceptable. I think that's why, organizations and, healthcare organizations should have zero tolerance, policies that, we don't accept this. So I've had an experience. I'll tell you two different experiences. One was a patient coming into my consultation room. In fact, it was my first day as a GP. I just qualified. So that was my first day of my first job. And it was a shock. This patient just came in and was so angry that they had been sat out for hours. But it was like a walk-in setting. It was a normal GP practice, but patients came in at 8 o'clock and signed in and left and sat down. So by the time I was seeing this patient, he had waited for a bit and he was upset. And I was just trying to apologize. Sorry for the wait, but you have to just come in on the day. And before I could say anything, he started throwing out swear words at me. I was so shocked. And I had to call the practice manager, and the patient was taken off the list, was warned and taken off because apparently I think he's offended more times than that. So that was a in your face kind of situation. I was shocked. I felt very intimidated. I was upset and shaking for that morning. So that one, I just escalated it to the practice manager to deal with because I just couldn't trade words with this patient. I had to remain as professional as I could. Another one was another patient that, first of all, I heard her in the waiting room saying she doesn't want to see that doctor. She wants to see a white doctor. And then she came into the room and she was just shouting at me. Nobody wants to help me. Nobody, do you even know what you're doing? And I just took a deep breath in and I said, excuse me, I'm sorry, but you are being really rude. And you've broken the doctor-patient relationship. I can't continue with this consultation. So please go back to the front desk and rebook with a doctor of your choice. I stayed as calm and as composed as I can. And then she broke down and she was crying and she was apologizing and saying, I'm sorry, I'm just so upset. I've got too much going. And it turned out there was a lot of issues on the background. So sometimes people react that way, but I had to nip it in the bud. And I just said, I'm sorry, but you've used some words that I can't accept. And you've broken the doctor-patient relationship. I'm sorry. And I had to send her back to the front desk. So two ways, either you escalate it, and if you feel that if you're going to deal with it, it's going to get worse, don't deal with it. Stay as professional as you can. Thank you.
Fantastic. Thank you for answering those questions. It is really disappointing to know that these issues are still out there, but simply they shouldn't be. And like you say, we've got rights the same as the patients have, and nobody should be experiencing that at work. So it really does go both ways. So thank you for your insight there. That's fantastic.
No worries. Thank you. Thanks for having me.